The pain that I had, I didn't even think about doing squats or leg presses. Enough was enough. So those were my signs that it was time to get a knee replacement. Now I'm back to squats, I'm back to deadlifts, I'm back to leg presses. I'm going to be picking up pickleball as well. It's allowed me to get back to what I wanted to do. Hi, my name's Trevor Froschauer. I live in the Chicagoland area, specifically the Naperville area. I'm 53 years old, and I've had both of my knees replaced by Dr. Karas, one in January of 2024 and one in February of 2025. So regards of knee pain in my life, it started probably at a younger age when I started catching in high school. So caught in high school, went to junior college for 2 years. After that, got drafted, played with the Astros, caught with them for numerous of years, and just literally, you just destroy your knees as a catcher. So I'm pretty sure every catcher one day in their life is going to go ahead and get some sort of knee replacement. The pain that I had experienced probably over the last 10 to 15 years was just constant knee pain, whether it was in the morning, in the evening. Family and friends were kind of like, why do you want to deal with this pain? You can just see that you're not as active as you used to be. You're not biking as much as you used to. You're not getting out and hiking, or when we did hike, it's like I can only go so far and then I've got to stop. Once I got to that point where it's just like, this is too much, talking to my wife, and she's like, well, go get it taken care of. So that's what I did. When it came down to kind of choosing a physician, Dr. Karas was actually one of the first physicians that I actually ever met when I was going through starting to meet some of the doctors. In my job that I do with ATI for physical therapy, going around and meeting all different types of orthopedic surgeons, total joints, everything. He was the one that I met in the very beginning that stuck out to me. And he was just so, he's just open, friendly, greeting, just the way that he treated patients when you came in, he treated you like you were one of his family. The fact that our physical therapist just can't stop raving about him and his patients that come in and how easy it is for them to actually treat him just made that decision for me that much better. And then when I found out he had gotten into the robotics and everything, it was a no-brainer. I mean, it was an easy choice for me to go with him.
I'm Vasili Karas, and along with my dedicated team, I'd like to welcome you to our practice and to Midwest Orthopedics at Rush. My life's work is motion. It's ensuring people's bodies can keep up to their fast-paced lives and activities. I always ask patients what they want to get back to and how they spend their days to gain a better understanding of how I can help. Trevor is not just interested in a well-functioning, pain-free knee. He wants to be able to lift weights, go watch football games with his kids, and live a very active life. There are many different platforms out there that do a great job, and it's my personal belief that technology-enhanced surgery is the future. Apollo specifically is most compelling because it leverages active balancing technology that gives surgeons the ability to understand and replicate how each individual patient's knee should function at its very best. This balance is why I think our patients recover very quickly and achieve a higher level of function than is otherwise possible. Trevor had very high expectations, and I knew I could meet or exceed them with our current methods.
Having the robotic knee was just, in my opinion, was the easiest recovery that you can get. Why people aren't doing more of it, I don't know. Hopefully this will help people understand that, yeah, this is the way you need to go when you need to get a knee replacement, is the robotic knee. So life after surgery for me has been remarkable. It's really turned around. I've had a lot of changes go on in my life when it came to my knees, getting them done. I'm getting back to biking continuously, getting back out and golfing, being able to coach my kids, being able to run back out on the field and not feel pain, hiking, getting out and doing hiking trails and stuff like that, like out in Arizona with my son, hiking camelback, things like that. Being able to lift and being able to get back into the gym and not just being able to lift just upper body, it's being able to get to the lower body that was so painful. So being able to do squats, being able to do deadlifts, being able to do calf raises, being able to do everything. I mean, I'm able to get back there and build my legs up. It just feels like everything's back to normal, like why I was when I was like 25, 30 years old. So I've actually had 3 or 4 people come to me already and ask me about, how did your knees go? I'm looking at getting this done as well. What made you do and go with the surgeon that you went with and with the robotic knee? And I just explained to him it was my recovery. I knew my recovery was going to be just outstanding with it. So if someone came to me asking about my knee replacement, saying, hey, why did you get them done? Should I get them done as well? I would say yes, 100% get it done. And also, you need to get it done with Dr. Karas. I've got a friend that did a total knee a year before me and had a lot of problems just getting back. And he's an active guy as well. But he had a lot of problems getting back, and his other knee is bothering him big time. So he's going to be getting in to see Dr. Karas, and he's going to be getting the new knee, because even his wife said, I can't believe how quickly you recovered compared to her husband. She's like, you recovered twice as fast as what he did. My world has changed. My life has changed since I've gotten my new knees back. It was a game changer for me. It really was. It was a life changer.